Hello, everyone. This is Claire at StudentRDH. By now, I think you can recognize my face and my voice. Today, we have a special student. Her name is Valezka. She's been very, brave to come here because we're going to talk about some real things, and those include anxiety. So welcome here, Valezka. Tell us where you're from.
Thank you. I'm from here. I born in Washington, D.C., but I grew up in Venezuela, so I graduated there as a dentist. But I came in 14 years ago, and since then, I'm trying to do the exam and I'm passing it.
Okay. So you studied dentistry over there already in Venezuela, and then you're here and you're trying to pass your dental hygiene board examination.
Yes.
Yes. And thanks for being brave. I know you had some struggles of your own. Can you describe some of those to us, please?
Well, in the beginning, my first obstacle was the language, because my native language is Spanish. Yeah. And then I studied 2 years in Miami Dade College of English. No? Then I started to do the test, the dental hygiene test. And that was in 2012, I think, the first time.
Okay.
I took 171, if I don't but remember the number. Then I was alone. I was alone in that time. I was studying only with the Darby's book.
Darby,
and myself. Yeah, and myself, and I didn't have nobody around like in the field, because I was working in a gas station, so was no dentistry at all in my around.
Okay.
And then I didn't pass it, and I tried again, and I did it again with the same way. So the same way myself, I thought that
must be Darby book, some of those.
Yeah, the Darby in that time, and was not success for me again. I get 172 in that time.
72, okay.
Yeah.
And the pass rate is 75, right? You have to
75.
get a 75. Yeah, and above.
Yes.
Yep.
The third time I was like super nervous. I always when I am in the place like studying the test, I forget everything. It's like my mind is erased. But I trust in my knowledge, and I started to do it. But the third time I brought the crack NBDHE, and that was like nothing for me, because nothing that I saw there was exactly in the exam. So I was like, this is not what I was studying for, so, and I get 170 in that time, so I quit. I was super frustrated, and I quit that time. And now, well, I'm with you, and I feel that the course is, for me, is the best, because in the material that you have, there is like steps that we need to follow, and one order in the things that we need to learn, and it's a lot better. It's a lot better. There is tests in the final part of each step, each material, and for me, it's the best. I think, and I feel that I'm studying in the right way now.
Okay.
And
when did you start
with the memory
techniques?
Yes,
that is so good. That's so good. Oh, I love hearing that. So tell us, Valezka, how long did you start with StudentRDH? How long ago?
Since 1 month ago, one and a half months ago.
Okay. Yeah. Perfect. And do you also have the book, or are you using?
Yes, now I have the book maybe 1 week ago or two.
Okay, okay. Recently you got the book. Perfect. And when is your exam date? Do you know, or you have not scheduled yet?
September 22nd.
September. So we have how many months? About 3 months left? Three and a half? Yeah.
Yeah.
Okay, good. Oh, I like it. It's a good time. It's a good time to study. 3 months is usually the perfect time to be motivated and to actually do a good job. Okay.
Yeah.
So,
I already finished with all the material. So in the computer, I did everything there.
You already did everything. Okay.
Yeah. Now I'm trying to do the mock every day, and do it again and again. And I took some tests from Darby that was was there. So for because of the COVID, they put free the samples of the mock that they have. So is another test that I have there to practice, But
yeah. Awesome. So you're saying you're doing the mock on the Darby as well right now, because so it's like, is it this book that you have? Is this the Darby book?
No, it's in the web.
It's different.
But
in
I
the
think
web.
the seventh edition.
Oh, you have the 7th. Yeah, I have the 8th edition right now in front of me. That's why. Okay.
Okay.
Okay. Yeah. Awesome. So, I would love to discuss, how you feel, because I feel like, knowledge is there. You prepare for a long time. You were also, working in dentistry, and you've done Darby book. Darby book is very comprehensive. So if you've done that, it's awesome already. You've done all StudentRDH as well. Even though you are trying to finish the book as StudentRDH, you have, I think, a lot of knowledge in you already.
Yeah,
how do you feel about your knowledge?
It's good, it's there, but when I try to apply my knowledge in front of one mock test, for example, I lost a lot. So I think that the answer is correct, but at the end it's maybe 60 or 69, the final score in the first attempt. Then I do it again and I take like 90 because I know what are the answers, right?
Okay.
But in the beginning, I'm always nervous. So my breath start to cut. It's like a mess.
Oh well, we'll change that. We'll make sure that you are ready to be on the examination. So, Valezka, I want to ask you, when you are preparing on your own, do you feel less anxious, or do you feel like when you do the mock exam alone, not in the test center, do you feel more comfortable?
Yes. So I feel more comfortable here, but when I'm studying, it's the same. Like the breath is starting to fail, like my heart is starting to beat a lot. So it's the same. It's like if I'm there.
Okay, so even when you're studying, you feel stressed.
Yes.
Is that correct? Okay. Well, I love this conversation because it really goes deeper into kind of our fears, and things that we do is already built in us. So this is probably not new. Have you always felt a little anxious when you were studying or taking exams when you were growing up?
Well, no, actually, no. I don't remember that kind of feeling. When I was young in my other country. No, I was fine. I think here is because of a lot of things are together. So the language, the new things, the new knowledge, because it's different in some parts are different. So for example, my weakness in the test was the math part of the radiology
Mm-hmm.
and also the statistic part, because the statistic there is completely different than the statistic here. So that was the most hard part for me. And now with you, I understood everything. So I hope, yeah, no, you're the best.
You are so kind. Well, we do try to give you the best summary, you know, because a lot of times the textbooks are a lot of words, blah, 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 blah. And especially if, you know, English is a second language to you, reading a lot of this is tiring. Like there's so many words, and do you really need to know all those words? No. You really need like really few things that you need to know to pass the board examination. So one of the things that, you know, StudentRDH is really focused on is giving you just the most important word, because I can tell you 10 different things that are important. No, one thing is important. Let's make our life easier. Let's not complicate things. You know, then when you have more time, you can add more to it. So I do like to see that you are making progress here with your knowledge, with the summary style that we have. And I would totally agree with you that language, I mean, not really, you know, having English, especially dental English, is different. It's it's a different level. So, you know, there's a lot of anxiety that can build because, you need to feel comfortable with the language. And second, it's like dental knowledge. So that's like also very difficult. The testing environment, they didn't create it to be comfortable either. And, you know, you have, you know, the history, and I don't mean to criticize you, okay? So you passed previously. So every time you failed previously. So every time you study, you think about failing.
Also, that's completely correct.
Yeah.
So it is heavy to feel it.
Right? It's like,
because
you know, a lot of here.
Automatic, I think that I'm going to fail.
Yes, exactly. And I would love to break that because you study with fear already.
Yeah.
Do you drive, Valezka?
Yep.
So even if we were driving, every time you drove, you would think, I'm going to get into an accident. Every time you would be driving, you would think, today I'm going to get in an accident. That gives you a lot of anxiety, right?
Yeah.
Right? You wouldn't be comfortable going to places. You wouldn't even want to drive. And if you were a good driver, you would make mistakes because your mind is now programmed to think, I'm going to get into an accident. So there's a funny.
We never think about that, so we're good.
So think about studying like driving. You know, don't try to think about I'm gonna fail. You know, if you start feeling that way, think about I'm just driving. You know, I'm not driving to get into an accident. And this is a funny thing. It's a study that happened is that, you know, when you're focused on something, you're actually gonna get there. Somehow you're gonna get there. So if you're focused on failure, you're going to get there somehow. So even when they get in an accident, they did this test with like professional drivers. Your hand is going to turn the wheel, the steering wheel towards what you're looking at. So let's say you got in an accident, you're spinning, your car's spinning. And if you look there on the right side, but if you're trying to move your steering to the left side, it's not going to happen because you're looking on the right side. So you're going to turn right.
Okay.
So what it is psychology, right? If you look to the angle, even though your body wants to turn left, you just can't. You're locked in your head.
Okay. So how can I do that?
So I want you to really imagine how success is going to look like to you. Can you start imagining, oh, actually, I'm going to pass this time. Have you visited the test center? Do you know where you're going to take it?
Yeah.
Do you have an address? Drive there, go there. Did you go there already?
No, to this one, because this is a new one for me. I'm going to try another one just to
of course.
You know, maybe
no, it's going to be good. I like it.
And other things. Yeah.
Energy is good. So here it is, Valezka. You're going to drive there.
Okay.
You're going to drive there and you're going to see everything. You're going to see the parking lot. You're going to see the door. You're going to see the elevator. You're going to take your book. Take a book, Okay, there, your studying book, and just
Okay.
sit on the bench and study for 10 minutes. What you're trying to do is seeing the end goal, which is the test center, and try to link it to something that you're going to do to get there, which is studying.
Okay.
And I want you to start feeling comfortable in that scenario. You can study in your car as well if you want to, in the parking lot. But what you're doing is fast forwarding yourself to that time that you're going to take the exam, but making yourself like you know what's going to happen already.
Okay.
So you're attaching this unknown, this scary thing to something that you can control. What can you control? You can control going there once a week. Go once a week if you have to, okay? Don't wait until the day of the exam to get there. Start getting there right now. Your mind needs to be trained. And then you're going to attach something that you can control, which is studying.
Okay. Perfect.
So you're turning, turning the scary thing into something you can manage.
Perfect.
And then when you come back and study at home, I want you to also think about the end goal. So yes, here's a test center. I've already seen it. I know I'm going to do well that day. For me to get there, well, I just need to study a little bit more. I've done already so much. And I know you have to keep telling yourself, Valezka, I know I'm going to pass.
Okay.
You know, every cell in your body needs to feel the same way. You mentioned energy. Every single cell in your body needs to feel that energy of success.
Okay.
Right? Because I think what, yes, you can do it. And I see your face, you're motivated, you are positive. And I think, you know, maybe this feeling of maybe I'm going to fail is actually a blanket. You know, it's actually sometimes you're like, if you promise your friend that you're going to make the most awesome dinner, then expectation gets like up there, right? When you're like, I'm not a great cook, but I'll do something for you. When it turns out great, they're happy, right? So maybe that's something we do to ourselves. It's not just you, it's everybody, including me as well. I put down my expectations. So when I see the result that's not that great, I don't get too disappointed.
Oh, okay.
Right? It's a protective mechanism in our head. It's not promising ourselves too much. But in this case, though, I do feel like maybe you lived in that blanket for a long time thinking, well, I'm going to fail again. You know, I've seen that fail report, but we need to change that attitude, saying this time I'm going to see a pass report. I know what's going to look like. You got to vividly see it. You got to see it like it's a real thing in your mind.
Okay.
And when you make up your mind, your body will respond the same way, because actually our mind and body can actually just be, you know, they can play differently. So your mind can think this, but again, the body can turn left when your mind is saying right. And even though your brain is trying to think positive, but the body's like negative, it can happen too. Right?
Yeah, it could be. I'm gonna try to practice putting something, for example, in my mirror in the bathroom. I'm gonna put I passed.
Yes.
So my mind will be positive.
You pass. You pass.
I'm gonna try to do something like that.
Awesome. And I'm so glad that you are willing to try this, because this attitude is really important. You want to. See, you want to. You want to. And it's not, I want to, I will. Okay? You will get there.
Yes, I will.
I will. So if you make up your mind, you know what? Studying becomes easier. You want it. So studying is not going to feel like scary anymore. It's like if you want the apple pie, you're going to start getting some apples. So it's like, you know, if you think an apple pie is scary and I don't know how to cook and I'm going to mess this up, then when you pick up the apple, you're like, you don't really want to do that. But now if you want to really do it, you know you can do it. Everything becomes easier. It's like, you know, do you dress up when you go out? Sometimes. I can see you
Yeah.
dressing up when you go out, right? It's fun, right? Because we want to, and we know, but putting the effort, putting makeup and dressing up is a fun process because we know the end result is having a good time.
Yeah.
So
I will.
yeah. So what I'm trying to say is because you made up your mind, the steps of studying is not going to feel like heavy or a burden anymore. It's going to feel like something easier to do.
Yeah. I feel this time that the method of the study was a lot easier than in the beginning. So that makes me more comfortable. I'm more in like secure that maybe the result will be fine.
Okay. And what do you mean by
Sometimes
method of
I think that I fell in some parts,
normal,
but I take the good road, and that's it. So it's not too hard. The problem is my stress.
Yeah,
I have to manage that.
Yeah,
but I will do it. I will do it. I'm gonna apply what you say. So I'm gonna go there. I'm gonna study there in the car or in one side there. So
make yourself comfortable.
I'm gonna do it. Yeah, I'm gonna do everything that is in my hands to be success in this in this process, because
I know
hard.
it's long, right? It's hard. I totally understand. And it's studying, it looks easy, but the only reason why it's hard is because it's not the content. Actually, the reason why it's hard is because the emotion we attach to it. Because we always when we were young, studying was fun because it was like play. But then after that, when you go to school, it's like tests, and like studying does not become fun anymore. It becomes something that someone else told you to do because you just needed good grades. And so it becomes when you don't want to do it, someone else told you to do it, you don't want to do it. It's like when my boyfriend tells me to do the dishes.
That is another thing that I had, because in the first 3 times before, I had my mother in my neck. So I always told her, I'm gonna try the test, and I'm gonna, oh yes, oh, you're gonna do it. Yes, was a big pressure on me that I need to
do
I
it.
need to do it. But this time, she doesn't know nothing. So I hide my test. I hide my studies. So I'm alone with it. So I tell myself, no, I cannot with that pressure. So will be a good present for her if I pass.
Okay, good. And I'm happy to hear, because it seems like it's like you want to take control of your own situation. It's like you want to do it. It's not someone else. That's good. That's another thing. Is like, have you heard of this term? And it's also in the dental hygiene boards. Okay, it's in the dental hygiene material that you have to study. It's in StudentRDH as well. But this term is called the locus of control. I know it's a weird word, locus of control. It's in the board's review that we have. Basically, what it means is like, if you feel like you are responsible and have the power to do something with your own ability, you're more likely to feel strong about it and to be successful, versus if someone else told you to do that. So if you feel like you control it, more likely you're going to be successful.
Okay.
So the fire needs to be inside, right? So that's the psychological term of locus of control. And if you feel like you're in control of your situation, that's going to affect you positively. So I just wanted to throw in a little bit of review over here, because in community oral health, you will need to know theories like that, right?
Yeah.
Some knowledge about theory. Let's say if the patient was in a situation they don't really want to brush their teeth, how can we help them? One of them is by making them understand that they are in control of their life. They're in control of brushing their teeth. They don't come to the hygienist every 6 months and have the hygienist do the work for them. No, you are in control. So if we tell them that they are, it makes them feel good. They're more likely to say, okay, I'm going to do a good job.
Okay.
Yeah, just wanted to do a little boards review here while we talk about this one. Yes. And Valezka, though, do you know, this time, I know your attitude has changed already. I definitely see that. I know you want to pass, and I want to dig a little deeper into, tell me what you're going to do when you pass. Like, can you imagine yourself being there? So let's put a little bit of story into the success. Tell me what you're going to do when you pass.
Well, the first thing is celebrate. Of course, celebrate. But I want to work as a dental as a hygienist, because it's like my dream. I always wanted to do it here. So, you know, dentistry per se is too much. It's too much time. It's too much money. It's too much work for me. No, that is not for me. But I want to be dental hygienist here, and always that was what I want to do.
Okay.
So I imagine myself in a clinic or something, like doing what I like to do.
Yeah. Awesome. And let's put more. We have to be real, okay? In our head, we need to be real. What are you wearing when you're working? Do you have an idea? Like, can you picture it? As a dental hygienist, you know, I want your dreams to become alive right now.
Okay. Well, I'm looking at me with all the things that we need to wear now, with the protection for the COVID and everything. Yeah.
Face shield.
Yeah. Right. And the things to protect with the
high-speed suction or the aerosol.
The special air, yes, that we need.
That's important. And then maybe when you start making money, maybe you're going to take your friends out for dinner.
Oh, yes, that is the best part.
Right? Yes, I'm loving it, because we're doing right now, you really are living. You're laughing, so you're understanding what it is to feel successful. So your body, your mind will adjust to that. One more thing, you know, how, you know, in kind of what dental clinic do you see yourself working? A small one, in a big one, a lot of people?
Well, I didn't think about that. But as much as better. So, you know, depending on the air that I'm gonna have, is like for each hour that I work or for the work that I do. So depending on that, could be a little one or a big one. So
okay, you don't really it depends on the scenario. Okay. Good. So, you know, again, this is just a practice to understand what your dreams look like, because when you go see that in your head, you're getting there slowly, and you have about 3 months to practice. So have you made yourself a study plan?
Yes, I did my study plan in the beginning. So I did all the first test, and then I took the weakness and I put it in order, and I studied by the order that makes.
So you have a solid plan, then you know how to take action. It's in there.
Yeah, I did it. I did it. Yeah.
Good.
I did maybe 1 or 2 days for each
full chapter. Okay.
Yeah, full chapter.
1 or 2 days. Okay, that's very good. And then also, did you give yourself enough time to do the mock exam and everything too?
I did the mock twice already.
Okay. Yeah. Wow. Yeah. You're really getting ready. That is awesome.
Yeah, and I'm trying to do again the first and second test because
Okay.
I think there is a lot of material that
Okay.
I sometimes forget, so I need to redo.
Okay. And Valezka, you're going to take it around September. There's a news about the NBDHE. So because students have been difficult time scheduling the exam because it's an 8-hour exam, they're going to shrink it. So that's the news, okay? I can't
Oh
confirm
yes,
that, but they're going to,
saw that.
yeah,
I saw
they
that.
might
You know
shrink it.
that.
Yeah.
Yeah, but I tried to do one reschedule for earlier because I think that is too far, and I have the I am terrified about forget everything.
Okay. Yeah.
Yeah. So I wanted to do it early, but
Okay.
I couldn't. Is everything full?
Okay, everything's full. Okay, so I'm just telling you that just because at StudentRDH, we are creating another mock exam that is according to the new format that they are working on. So we're working on that as well. So you might see it in your dashboard soon. So, you know, it's good because you can have more practice.
Yeah.
So you're going to see
that.
that.
Is super.
Yeah. Great. And you'll have enough time to practice all of that before you go to the board in
Thank
September.
you, because you're amazing.
Oh, thank you. No, I'm very, very thankful to work with students like you who are motivated, who want to go to the end goal. And, you know, I have no doubt that you're going to pass. The reason I say that is because you actually have a very positive energy.
But, you know, well.
I see that. And I'm sorry, the past failures that you have experienced is holding you back.
I was very alone. Alone in the beginning, so I think this will be the time. So I have here some things that I want to show you about the things that I'm doing.
Yeah.
So, for example, these are some things that I. Oh well, yes. This is the plan. This is the plan completely.
You have a full plan. Oh, thumbs up, thumbs up. Wow, I love it. Hey, stay there. I'm going to take a picture of you with this. This is amazing. Okay, you've done it. Perfect.
Yes.
Wow.
And then in the back part, I put some things that I want
techniques
to put in the
nerves. Yeah.
In the look that they give us with a pen in the beginning.
Yes.
So for me,
you're gonna put that.
Super. Yeah, I love this.
You're gonna just draw it. Perfect.
Yeah.
The nerves.
And
a video for that. It's
this
about the
this year was amazing. Also,
it's about the radiology. Is that calculating the milliamperes and this and that? Perfect. So you've seen the videos.
Also was super.
The eruption pattern.
Yeah, that was amazing. Also,
and excited like that, and then I love it. So what Valezka just showed us is some of the things that we teach in memory techniques at StudentRDH, the eruption pattern. So I have you draw a certain way. So it's not really memorizing 7 to 8, 8 to 9. It's like not boring, but you draw it. So it's like an MAN, but you know, I give you specific instructions, and once you do it, you're not going to forget it, right?
Yeah, and I think it's super to have that kind of things, to know what is going to be the best things that we need to put in that thing that they gave
notes. Yes, because example, when you go to board,
this is another thing that I love.
Cranial nerves.
Yeah.
Or the
what amazing.
I
always
some say Mary Money, my brother. Yeah. Awesome.
Yeah, I love it. And what else? Oh, here.
Let me see.
I love this.
Oh, the blood pressure. The knobs. I told you, like turn on the knob, the right, the left. Oh, I'm so happy. You are really following everything that we are teaching at StudentRDH. Hey, I feel like your confidence is way up already. Your confidence is good, right?
And this, I love this also.
Which one is it? Is it the, sorry, I
The,
can't really see. A cal, is that cal,
it's
or
for,
inverted square law, inverted square law
uh-huh,
when you are doing radiology?
yes,
Mm-hmm.
uh-huh,
Wow, you
yeah,
are a
and also
fantastic student.
there is a
Cal, yeah, yeah.
that there.
Yeah, yeah. Plus and minus, recession, you add
Exactly.
them.
That was
Oh.
things that was hard for me, and I was like, okay, this is
Mm-hmm.
super comfortable. I
Mm-hmm.
need to write it
Mm-hmm.
down, and I
Mm-hmm.
need to be in the moment with that in my mind. So
Okay.
I need to do it.
Okay. It seems like really
Yeah,
just being able to have some memory technique is helping you as well. It's really helping you be more
yeah,
confident in your brain
yeah,
because you don't want
yeah,
to
and I
forget, right?
love them. No,
Uh,
no, I think.
uh-huh. You've worked enough, hard enough to never forget, right?
Yeah,
Okay,
no, no,
okay.
no. The cranial nerves and everything that was
Uh-huh.
amazing. I
Okay, okay.
love it. I love it. I
Oh,
always was, in the air with that kind because was letters and letters. How you told me was a book
mhm.
and okay,
Much.
all the information is
Blah,
there,
blah,
but
blah.
is yeah, mixed.
Yeah, yeah. And now it's a lot
Yes,
more organized, you feel like.
yes,
Okay.
yes.
I'm really happy to see that. And I feel like,
Thank
I
you.
mean, just there's a lot you can tell by a person, by the way they talk, the way they smile. I feel like you're very confident now. And I really just,
I feel it.
I will be here. You can email me again and say, hey, Claire, I don't know how to
Thank
memorize
you.
this. You tell me, maybe I can come up with something. Because
Okay,
how,
perfect.
yeah, how we grow is by listening to our students. So if you tell me, Claire, oh, I'm really having a hard time here, maybe I can say, oh, actually, I have a memory technique for you.
Perfect. Thank you very
Yeah.
much because that is super. That is
Mm-hmm.
super.
Mm-hmm.
For
Good,
me
good.
was, super.
You work really hard, okay? You
Yeah.
work, you're working really hard, and I'm happy to see that you're finding the memory techniques helpful. Because the thing is about the memory techniques, it's like glue. It's like it's sticky in your brain. It's not gonna just evaporate
Yeah.
like that.
I completely agree. It's like
Mm-hmm.
that.
Mm-hmm.
And I never took notes like, in the beginning I did
Mm-hmm.
it. In
Mm-hmm.
the beginning in the past I did a lot of, notes and
Notes, yeah,
things
yeah.
and papers and a lot of things. Now no.
Mm-hmm. No
I
notes.
I
Focus
took
on
your
the book.
advice,
Yeah.
yeah, and I never took any notes. My
Okay.
notes are these ones.
Okay,
So the
good.
things
That's
that I
perfect.
need to put only. That's it.
Perfect. That's it. Because I totally agree. Notes are like just too much blah, blah, blah. No, let's
Mhm.
just focus on what is important, what you have to memorize.
Yeah.
And those notes, well, because they're very visual, they're like drawings, right? So they are
Mhm.
so much easier to understand. So I'm really happy to see also that you are shifting from the traditional notes, just which is just a lot of writing,
Yeah.
to really what's important to you.
Yeah. I
Okay.
exchanged that because of you.
Mhm. Oh, well, thank you. You are,
No,
it
no,
makes
thank
my
you.
day all the time. Makes my day to know our students are getting really to the end goal. And Valeska, again, please, in the meantime, email me. Know that you're not alone, okay? It's me.
Okay.
It's not actually just me. We have team members here who are faculty members, who used to be faculty members. You know what? We have past graduates, I bet, who are also willing to help. If you say, I need help with this, we can ask everybody who used StudentRDH before. Thousands of students say,
Awesome.
hey, we have someone who needs help here. So feel free to
Thank
ask
you.
anything. Okay.
Thank you very much.
Yeah. Oh, well, it's been a pleasure talking to you, Valezka.
Oh, for me
Um,
too.
yeah. I wish you the best. And you just keep
Thank
updating
you.
me, okay?
Okay. Thank you very much for everything. Thank you for your help, for your support. So no, I
Oh,
really feel better now.
uh-huh.
I feel more comfortable about
Mhm.
the things that I'm doing,
Oh,
and now I know that I'm doing the right things. So
you
thank you.
are. You are completely doing the right thing. So have no doubt, and just make yourself comfortable by driving to the exam, trying to just feel that energy over there.
For
Um,
sure, I'm gonna do
building
it.
in your head, yeah, that you can. All right.
Okay. So
Well, I'm gonna
thank
let
you
you
very
go.
much
Yeah, yeah,
again.
yeah. And I just want to hear that you passed next time, okay? Yes, yes, it's gonna happen.
I
Okay, I will. Yes, you will.
will.
Perfect. So I'm gonna
Okay,
leave you
so
here
thank you very much.
today. Yeah. Okay, so
Nice to
talk to you
meet
again then.
you.
You too. All right. Bye.
Bye.